Hi learners, it's Em from Sound Nerds, and this video is going to focus on the thyroid, looking at benign pathology. So if you can identify benign nodules by name, it's really going to help you in your overall understanding of thyroid nodule imaging and patient care. If you haven't already, go back and watch the TIRADS video. It's going to cover benign characteristics and malignant characteristics in a lot more detail. But just to recap, benign thyroid nodules share some common characteristics. We see that they are usually cystic, and we especially see that cysts less than 5 millimeters are definitely benign. They also take on a hyperechoic to isoechoic appearance, might have a spongy appearance to them, look wider than tall, have large calcifications, and appear as hot nodules on nuclear medicine tests. A large percentage of adults have benign thyroid findings, making them a very common occurrence in imaging. So we're going to cover the most common benign nodules, which include adenomas and cysts. Now the cysts are going to come in a couple different categories, which are going to include simple cysts, colloid cysts, and hemorrhagic. So let's go ahead and start with adenomas. Adenomas are a benign encapsulated tumor of the thyroid. And you may have heard of adenomas before. You can have an adenoma in your liver, or in your spleen, or in your kidneys. It really is just kind of an abnormal expression of the tissue in whatever organ that it's found in. So in the thyroid, we see that the adenomas arise from the follicles, which is why we also call them follicular adenomas. When palpated, they often feel like a firm and rubbery ball underneath the skin, and the capsule that surrounds it is made of a thin, fibrous tissue. On ultrasound, adenomas are going to appear as a discrete nodule, meaning that they'll be a very clear, distinct, different structure than the rest of the thyroid tissue. Adenomas also have some variation in how they appear by ultrasound. Most commonly, we'll see them as solitary, homogeneous nodules that have a thin hypoechoic rim around it and have some vascularity within that rim. So in this image here, we can see the thyroid tissue on either side of this very clearly demarcated nodule. So this is an adenoma. We can see the thin hypoechoic rim around the outside of it. It's continuous all the way through, smooth borders, and if we were to put color on this, we might see a little bit of vascularity out there. But adenomas do have some variant appearances that can kind of change what we think about them. So here's an example of an adenoma that has some larger cystic spaces in it. Gotta love this picture because it looks like it has a little face in it. We also see that some of them might not have that rim as clearly visible as that first example that I showed you. You might see that they look a little bit more hemorrhagic, or might express some cystic degeneration, which means that part of the solid tissue is starting to liquefy. We already learned about multiple nodular goiter, and that's due to hyperplastic nodules, which are also called adenomatoid nodules and follow a very similar pathophysiology as the adenoma. The halos may or may not be visible and tend to be multiple nodules in that setting of multiple nodular goiter. So we can see here we've got a long view of the thyroid, and we can see multiple solid nodules just abutting one another. These make for very tricky ultrasounds. Oftentimes we will default to imaging maybe the largest, if they all look the same, to maybe the top 3, depending on the reading provider's preference. As a recap then, adenomas are benign encapsulated tumors of the thyroid, also known as follicular adenomas. If they are large enough, they might be visible or palpable on the outside of the thyroid. It is not uncommon for a doctor to do a physical. They feel around on the neck and say, hey, I think your thyroid's enlarged or that there's a nodule present. Let's get an ultrasound done. More likely to be in females. If they have a nuclear medicine test, they'll typically show up as hot nodules, especially if they are overproducing thyroid hormones. Otherwise, the labs are often quite normal in the setting of adenomas. And the one thing that really sets adenomas apart from a lot of other pathologies is that thin hypoechoic rim. Next up, we have thyroid cysts. So the thyroid can develop cysts just like any other organ in the body can. And we often see that they take on one of 3 appearances. A very simple cyst, which is relatively rare, a colloid cyst, which is much more common, and then hemorrhagic cysts, which are often associated with degenerating adenomas. Cysts that are simple are benign, but can still cause the patient some discomfort. A cyst aspiration can be performed, but oftentimes the fluid will return. The fluid within them is considered a serous fluid, and if you've ever had like a scrape and noticed kind of a watery substance oozing out of it, that's serous fluid. So that's what fills these cysts, and it's kind of a pale yellow, and again, benign. So simple cysts on ultrasound are going to be anechoic, smooth-walled, with posterior enhancement. Colloid cysts are also anechoic, but tend to contain small echogenic foci. Now, we learned earlier that small calcifications are worrisome, but what makes these different is that they exhibit a comet tail artifact. So if you see echogenic foci, make sure that your images are showing that comet tail artifact, so TI-RADS grading is appropriate. In this example on the left, we can see that we have a nice smooth-walled anechoic structure with through transmission, but then we have these internal echogenic foci that kind of look like they're smeared down the image. And that's that comet tail artifact coming off the echogenic foci. So this is a colloid cyst. This is a little bit of a larger one. I would say more commonly we're going to see a bunch of little ones kind of scattered throughout the thyroid tissue. Oftentimes it's just one little echogenic foci with that comet tail artifact in the middle of a small anechoic circle. After an adenoma appears, they have the capability to actually start to degenerate, which means that they kind of start to liquefy. And when they do this, the nodule is going to start to bleed in on itself, causing large cystic components in what was originally a solid nodule. As that blood collects within the walls of the cystic area, it's also going to form some internal debris, or what looks like solid pieces. The solid pieces tend to be clots of blood. And so when we put color on a degenerating adenoma or a hemorrhagic cyst, we should see that there's no blood flow in the solid components that are within the cyst and only on the periphery. So here's an example of a degenerating adenoma or hemorrhagic cyst. Again, we can see on the outside here, we've got that peripheral vascularity, but we see no vascularity on this solid component because this is most likely a blood clot within the mostly anechoic fluid. To recap thyroid cysts then, remember that we can have a simple cyst, which is very rare but follows the same ultrasound appearance as all simple cysts. Colloid cysts are going to be anechoic but have that foci with comet tail artifact. And then lastly, our hemorrhagic cysts are going to be anechoic with some internal debris and septations, but should have no internal vascularity.